Thank you for having me today, and I'm happy to be with you talking about lung cancer. And as you know, that lung cancer is worldwide is number one type of cancer, and fortunately, it's also number one cancer-related death worldwide, and probably in our area, lung cancer it's ranked like number five or six, and we have an increasing trend even in females. Lung cancer commonly in males, but since now smoking habits start to be more common in females nowadays, so we start to see a lung cancer increasing trend also in females. Well, unfortunately, people starting smoking at young age, usually between 20 and 30-year old.
Mm.
And um, you need at least 20 to 30 years of smoking. So probably by age of 50, this is the most common age of having lung cancer. That's why most of the recommendations to the screening CT scan at age of 50. So if you're smoking and age of 50, please do screening CT scan. Not only nicotine, there's
Okay.
almost 300 compound inside the cigarette smoking itself. So all of this can cause mutation. This causing a damage in DNA, and any damage in the DNA, which is the our code of inheritance, the DNA, if there is a damage that needs repair. So damage and repair, this repeated process, it may end up by mismatch repair. And if there is mismatch repair, that's mean mutation, and mutation eventually will lead to cancer. Lung cancer is the most common one, but it's not the only one linked to smoking. We have almost 30 type of cancer linked to smoking. Let's first to talk about the most common stage of presentation of lung cancer in our area is stage 4. Unfortunately, patients when presenting, they present very late stages. This is approximately in 80% of patient populations, they presented in very advanced stage. And this probably patients, they reported their symptoms or they presented to the doctor in very late stage and they ignoring their symptoms. There is no specific symptoms that we can say, oh, this is really related to lung cancer, but in general, cough is one of the most common symptoms, or coughing, especially coughing blood, or shortness of breathing. These are common symptoms of probably there is something like warning or alarming. We have to go to the pulmonologist or the family physician for doing some scans to rule out underlying lung cancer. But if someone who is a smoker and he has a cough which is not resolved for quite some time, they have to go to the doctor and to do some checkup. The second thing, why should wait until you have a symptoms? Because when you have a symptoms, probably you are having a little bit advanced stage. Luckily now we have a screening program for the lung cancer, and I think it's approved by most of the insurance that majority of patients, they can have an access to the screening program for lung cancer, doing like an low dose CT scan, which is a very simple CT scan for those smoking, and they are at age of 50 years or older, and they smoke for more than 10 years. I think they have to go for a screening program for early detection of lung cancer. Knowing that lung cancer in early stage, like stage 1, stage 2, the cure rate is very high. In stage 1, the cure rate in stage 1 approaching 90%. If you compare to stage 4, which is the majority of our patients coming with stage 4, there is no cure, and even the 5-year survival, unfortunately, will drop to only 5%.
Mm.
Fortunately, no. Lung cancer is not hereditary cancer. As I mentioned, it's mainly linked to smoking habit. It's the same, same tobacco smoking. Smokeless cigarettes or whatever electronic using now, it's the same concept. It's the same risk of having cancer. Probably some people they're using to quit smoking, but it's a matter of changing the style of the pattern of smoking from the traditional cigarettes to the electronic cigarettes, but they are at the same risk of having lung cancer. The risk will be much less when compared to the actively smoking patients, but it's still at high risk of smoking. So each one or every person who's smoking just has to know that he's not harming himself only, but he might harm the loved one who is living with them, like the wife, like the kids. So it's not only him. Majority of patients with lung cancer are linked to smoking habit, and this is the majority of patients they having a history of smoking for quite some time, and some patients they what we call passive smoking also they at higher risk of developing cancer. But really we have another group of patients, those never smoking, and also they may have lung cancer, but those usually because of some mutations in the tumor cells that drive this cancer, and usually they have a much better prognosis with the compared to other type of cancer, which is linked to smoking habit. So yes, you're right. We have a small percentage of patients, mainly in females. They may have lung cancer without any history of smoking, and even they never smoke. But in general, they have much better prognosis.
Is lung cancer?
We know that there is some people who consider themselves like blood smoker or occasionally smoking. But if they are smoking for quite some time, more than 10 years, that's also putting them at high risk of developing cancer itself. So even those light smokers or they're smoking occasionally, and I think in our population, majority are smoking shisha, and maybe it's like once or twice weekly, and they consider themselves that the light smoker. Actually, smoking one shisha equal 20 cigarettes. I mean, one box per day. So this not light smoker, but people they consider them this is I'm smoking only occasionally or a light smoker. But again, they are at high risk of having lung cancer if the between brackets if they are light smoker for more than 10 years, still they are at high risk of lung cancer, unfortunately. So I advise everyone who's smoking and looking for to quit smoking to visit these clinics. So they have many options to help the smokers to quit smoking, because there is different methods, different tools, and every patient or every person should be treated differently. It's not one thing that will be applied for all of the patients. So by visiting the smoking cessation clinic, I think this is one important step. This is a very good question. By quitting smoking, that does not mean that you are zero risk of having a lung cancer. Still you're at high risk of having lung cancer because I've been smoking for many years, but the risk it will be less. So you will decrease the risk of having lung cancer, but this will not be 0%. So still you need to do screening CT scan. the risk of having lung cancer and how it is one of the very bad type of cancer. But also I need to reassure the community that currently we have treatment for patients with lung cancer, and the progress in the treatment are now we have a very big step in treating lung cancer. We have the immunotherapy, we have the biological therapy, the target therapy. So, and we have changed the treatment paradigm or landscape of lung cancer, and now some patients we used to be incurable in the past, now they have a chance to have a cure for lung cancer. So this is one of the good news, at least for those patients, those unfortunately having lung cancer, that we have a treatment for them. Yeah. I think we have to consider November is the month of screening for lung cancer, as we did it for October in breast cancer. And this campaign, I think it's one of the most successful campaign to conquer breast cancer. I think lung cancer, it's the same, and it's one of the deadly type of cancer, and very dangerous. Why not to consider November is a month of screening for lung cancer, and every single patient who has smoking habit or history more than 10 years, why not to have like just a simple CT scan without contrast, low dose. It would take only 10-15 minutes, and this will help a lot to early diagnosis of lung cancer in very early stages, where there is a very high chance for cure. Second, we have now like in smoking cessation clinics, I think in many hospitals, many clinics, and everywhere. And just if you are smoking, why not to visit one of these smoking cessation, and they will help you to quit smoking. And by quitting smoking, you will decrease the risk of having lung cancer. So this is the most two things that everyone has to do it in November, a screening program or screening CT scan, and try to visit the smoking cessation clinic.